Elizabeth Scala here from elizabethscala.com. So first off, thank you so much for watching these videos on YouTube or my website at elizabethscala.com or wherever you might find them. I appreciate that very much. And we are wrapping up a three-part video series that happened this month pertaining to how do we invite more of the art of nursing into our professional practice? How do we blend the art with the science? How do we complement the two? The first video talked a little bit about scalp massage and how that helped relax the patient. The second video went into eye contact and really looking someone in the eye and taking that time to smile, pause, introduce ourselves. And this third video is not exactly like the first, but does involve touch. So I actually run, if you don't already know this, a National Nurses Week program for hospitals called The Art of Nursing. And the first year, which was 2014, the entire premise of that program was around how do we do this? How do we invite the art into the science of nursing? So all 12 experts I interviewed were answering questions specific to that. How do we blend the art with the science of nursing? And they answered the questions based on their expertise, based on the tools that they teach, based on the content they provide. And so one thing that comes to mind is touch. When you go into a patient's room and you're assessing them, just simply placing a hand on a shoulder. When you're getting someone prepared to go off the unit, transfer to maybe take a test in the wheelchair, just placing a hand, right? I actually heard from a nurse who follows my work on social media who said she is actually trained to be a Reiki practitioner. And as a Reiki practitioner, anytime she places her hands on a patient, just connecting through that energetic healing modality. So my practical tip here for this week is healing touch. Now, there's many varieties. The American Holistic Nurse Association has lots of information on their website. And some of the healing touch modalities include therapeutic touch, healing touch, Reiki, and those are just three. There are many, many other ways, many other energy modalities that we can connect with as nurses, that we can invite to our practice, sort of add these skill sets. And once we have them, utilize them anytime we interact with a patient. So my dog is coming over here to sort of touch me. I don't know if you can hear his little feet pitter-patter. But my final tip for this week is really all about making that connection via touch. So that, again, it doesn't take extra time. You're in there with your patient. You're doing those scientific skills and clinical techniques that you have learned as a nurse. But then you're adding in the human touch simply by placing a hand. And if you've had a complementary modality training, bringing that to your professional practice. So my final words to you this week are actually a question. Who out there is bringing the art of nursing to their practice, and how? I'd love to hear what others are doing so that I can share it along with other nurses. So how do you bring the art of nursing into your practice? How do you blend the art with the science? So if you're not already a member, head over to Facebook and then search for the Art of Nursing group. Join our online community and let me know how you bring the art into the science of your professional practice. Thanks for watching and enjoy the day. Thank you.